president of our club, and thank you all for joining us today. I'll start out by inviting past President Jerry Smith to the podium, who will give us some words of inspiration. Jerry.
Thank you, President Howard. So, words of inspiration, a moment of inspiration. What a tall order. The moment part's going to be easy, guys. Don't worry about that. But the inspiration is going to be a little bit more challenging, especially when I'm talking to a group of people like this today. As you heard, Rotarians are people of action, and results are best achieved in partnership with others who share our ideas for savings, for sharing a vision of the world, a better world, and for partnerships with organizations like MedWish, who we're honoring today. Together, we can help one another, we can build our community, and we can imagine a world where everyone has access to resources, opportunities, networks, and support to thrive. We can acknowledge our differences and celebrate the contributions that we offer through an inclusive culture where every person knows they are valued and that they belong. Rotary believes that peace is achieved through understanding and by encouraging conversations that build harmony across cultures. But as we were taught, our actions speak louder than words. So may today's celebration of compassion, ingenuity, and people helping people inspire you to take action, however small or large, and make a difference for someone less privileged. And that's my moment. Thank you.
Thank you, Jerry. That was beautiful. Perfect. We're honored to have such a large number of guests in attendance for today's award presentation, which includes so many from the international community, civic, and cultural organizations. We're not able to introduce all of our guests individually today, but please know how much it means to us, to all of us, that you are here today. So thank you for being here. I'd also like to recognize Rotary District 6630 Governor Dale Smith and also our 6630 Governor nominee, who are both here with us today. Welcome. On behalf of all Cleveland Rotarians, I extend each of you a warm Rotary welcome as we celebrate our annual International Fellowship Day at the Rotary Club of Cleveland. So now we're going to begin today's very special ceremony in recognition of International Fellowship Day and the presentation of the International Service Award. I'd like to share a bit of history about Rotary International, the world's first service organization. February 23rd is Rotary International's World Understanding and Peace Day. It commemorates the first meeting of Rotary that led to the formation of Rotary International back in 1905, making this the 120th anniversary. In 1985, Rotary International launched the Global Polio Eradication Initiative, the largest humanitarian undertaking in history, which gained support from the World Health Organization, UNICEF, the U.S. Centers for Disease Control and Prevention, and the Bill and Melinda Gates Foundation. We have effectively reduced polio cases by 99.9% since Rotary immunized the first child against polio in the Philippines in 1979. Today there are more than 46,000 Rotary clubs and over 1.4 million Rotarians in more than 200 countries and geographic regions on all 7 continents of the earth. For today's International Service Award presentation, it is now my sincere pleasure to invite past District 6630 Governor, past President of our club, and Chair of the International Service Committee, Julie West, to the podium.
The Rotary Club of Cleveland International Service Award is an annual recognition of the global contributions and impacts of individuals and organizations from Northeast Ohio towards the furtherance of world peace and understanding. We're glad to have all of you here with us today. Previous recipients of the award include Ronald B. Richard with the Cleveland Foundation, Dr. Toby Cosgrove, then with the Cleveland Clinic, Dr. William B. Griswold, then with the Cleveland Museum of Art, and most recently, the United Ukrainian Organization of Northeast Ohio. We also welcome former recipients and organizations who are in attendance with us today. That includes Cleveland Honorary Member Don Hansen from clevelandpeople.com. And we are also honored to have representatives from the Cleveland Cultural Gardens, Cleveland Council on World Affairs, Margaret Long and Associates, Global Cleveland, and Esperanza. And thanks to you for joining us. This year, the Rotary Club of Cleveland is proud to recognize MedWish with our International Service Award. MedWish, founded by Dr. Lee Ponsky in 1993, is a nonprofit organization that saves lives and helps the environment by repurposing surplus medical supplies and equipment to provide humanitarian aid to people in need across the world. For a number of years, Northeast Ohio Rotary clubs have partnered with this Cleveland-based organization to further our shared goals of improving health care around the world and stewarding our environment. One example occurred in 2008 when our club, in partnership with our district and the Rotary International Foundation and the Rotary Club of Nairobi, Itimishu in Kenya. With the help of a grant from the Rotary International Foundation, we were able to establish a pediatric surgery unit in the Mather Hospital there. And MedWish, at that time, played a key role in this by providing the critical medical consumables required for the surgical procedures. More recently, members of Rotary clubs in Northeast Ohio have volunteered at the Greater Cleveland at MedWish. And some of the folks, Rotarians here today from the Rotary Club of Heights of Greater Cleveland, were actually there yesterday volunteering. So I'd encourage other Rotary clubs to join us in volunteering there. It's a great purpose to serve. For those who are not yet familiar with MedWish's model, I believe that after you hear about it today from Britta Last, the CEO, you'll see why this organization is worthy of this award and why the recognition is both timely and hopeful. Rotary's model of service above self and MedWish's role of people helping people blend beautifully. At this time, I would like to invite Britta Last, Chief Executive Officer of MedWorks, they recently merged, to the podium, and also ask Past Honorary President Ingrida Buglis, Honorary General Counsel of the Republic of Lithuania, to join me as well. Britta. On behalf of the International Service Committee and the Rotary Club of Cleveland, it's my honor to present the 2025 International Service Award to MedWish Networks. The CEO, Rita. So this is a crystal, and I presented to Britta to honor you and your organization. And what it says is International Service Award, MedWish Networks, February 13th, 2024, from the Rotary Club of Cleveland.
Well, the warmest congratulations to MedWish. I have a few greetings, proclamations from our government officials, and I will start with our governor, Mike DeWine, who sends his warmest congratulations, and also thanking MedWish for the great work they do all over the world. We have a proclamation also from our county executive, Chris Romney, who actually spells out a lot of the work that's being done by MedWish, but at the same time, he ends this beautiful proclamation with the words that what MedWish is doing is actually according to the Rotary vision around the world. And it's signed by County Executive Chris Romaine. And we're always honored that our Cleveland Mayor, Justin Bibb, recognizes Rotary and each year the International Service Awardee, and this year MedWish, and he wishes them all the best in the work because their work that they do is an exemplary work for all those generations to come. And signed by our Mayor, Justin Bibb.
Thanks, Ingrida. At this time, it's my privilege to officially introduce today's speaker, Rita Lang. Her first experience with MedWish was actually as an intern. And she actually did that twice, several years apart. And then she officially joined as the Director of Business Operations in November of 2015. In March of 2018, she became the Associate Executive Director, and in November of 2021, she moved up to Executive Director. And most recently, with the merger of MedWish and MedWorks, she is now the CEO of the merged organization. Please welcome MedWish MedWorks CEO Britta Lance as she tells us much more about the organization.
Good morning, everyone, or good afternoon, I probably should now say. I'm glad that you're all eating because I can honestly talk about MedWish MedWorks all day, so this gives me a lot of relief that at least you're eating while I'm speaking. But truly just want to thank all of you for giving us the opportunity to be able to share about the work that we do and for these incredible honors. The work that we do is life-saving and truly impactful, and we work with many of you to make all of that possible, so I really want to thank everyone in this room here today for, again, hearing about what we do, being involved with what we do. Some of you I know are our recipients, some of you are volunteers. Many of you have shared the word about what we do as ambassadors for our work, What I'm about to share today is really only possible thanks to our incredible community, and you all are part of that, so thank you. So I would love to share a little bit about the work that we do. I'll focus on our international efforts because we do have a variety of different programs that are both domestically focused and also international, but I do want to share a little bit because I know today there's been MedWish, MedWish International, MedWish MedWorks. I just want to share a little bit about some of the changes at our organization in the last year. So MedWish International, as was shared, was founded in 1993 by Dr. Lee Kronsky with the mission to be able to collect medical supplies and equipment that are in surplus here in the United States and ship them internationally to help those who are in need around the world. MedWorks was founded in the early 2000s by Lee's brother, Zach Kronsky. So there was always a connection right from the start after he participated in a MedWish medical brigade and really started to reflect on the fact that there's so much need here in Cleveland for free health care for those that otherwise are lacking access to medical services that many of us enjoy at the incredible healthcare institutions in our community. And so MedWish and MedWorks have been operating independently of each other, certainly partnering in many ways, but as separate nonprofits. And this past year, our board voted and approved, and we are now one unified merged organization, bringing all of the incredible programs that we have under one roof. And so we're really excited, as you can see on this slide here, together we can do even more, together we can make an even greater impact, because at the core of what we do, we are providing access to all the different resources, all the different things that people need for their health and wellness. So as a merged organization, our mission is we're dedicated to advancing health equity and environmental sustainability. We achieve this by providing essential care, redistributing surplus medical supplies, and connecting medically underserved communities with vital resources, both here in Northeast Ohio and around the world. We envision a world free from healthcare disparities where everyone has access to high-quality care and essential resources, harnessing the power of volunteerism and partnerships. As I've shared, all of you are part of that, included in that. We work to eliminate barriers to medical supplies, referrals, and to care, empowering individuals to live healthier lives. Because I can't have you all at our warehouse to be able to kind of walk you through what we do physically, it's always helpful to have videos and pictures to be able to better explain the work that we do. So I'd love to show a brief video. You're not settling in for a feature film here, but 4 to 5 minutes. Just explaining about how MedWish was founded. Please bear with us as we just merged in September, so not all of our marketing pieces and our videos have been fully combined yet, so you will see in the videos and the photos that you'll hear MedWish and MedWorks. Independently, we are again one unified organization. So I'm going to show this video really highlighting how MedWish was founded with our international work, and you'll hear it from Dr. Lee Kronsky, who is our founder, who tells this story the best. So hopefully that gives you a pretty good sense about our international work and how we do what we do and the focus on environmental sustainability and on the impact that we're able to make on people's health. To kind of go into a little bit more depth with it, as you saw in the video, there's multiple stages of the work that we do. And again, I would love to invite any of you to come to our warehouse. We are a Cleveland-based organization, and we're really proud to be here. We have a building in Midtown where we're collecting and sorting and redistributing all of these supplies out of. And we'd love to have any of you come and see the work that we do firsthand. But our recovery process, to explain a little bit deeper, we are really, really lucky to be embraced by the medical community here in Northeast Ohio and further distance than that as well. Every year we work with over 250 different corporate locations that will donate supplies to us from our hospitals, manufacturers, private practices, and individuals. We had over 1,000 people who came to our doors to drop off supplies last year. Something that's really important that I want to highlight is all these items are good and viable. We don't collect supplies that are expired. We don't collect supplies that are broken. We want to make sure that everything that we distribute is of good quality, and if it wouldn't be considered to be good to be used on me, it shouldn't be used on somebody else. And so it's really important to us that we educate all of our donors as much as possible, but all of these supplies, when they come into our warehouse, we're just really thankful that people are helping us to give it another life and to help us get into the hands of people that need it. So in total, we collect over 600,000 pounds of medical supplies and equipment every year that would otherwise be destined for our landfills, but can otherwise have a second life. And since we were founded, it's been more than 9 billion pounds of supplies. which is really incredible to think about, as most of the supplies that we receive are from right here within about a 2-hour driving distance from us. Volunteers are critical to the work that we do, as you already heard today. There are many, many Rotarians and Rotary clubs that come out and volunteer, and we can't express enough how thankful we are, because volunteers are what makes all of this possible. When these supplies come into our warehouse, they're unsorted, we don't know what's in them. When we redistribute these supplies, as you'll see in just a few slides, all of our shipments are tailored to exactly what our recipients are looking for. So we're not just going to send a random box of supplies to anyone because we don't know what's in it. We want to make sure that we're really truly meeting their needs. And so our volunteers are helping us to sort, pack, and get these supplies ready for redistribution. And we had over 18,000 volunteer hours doing just that last year. So you can imagine we have around 3,000 volunteers every year that come and help us with that process. We're a small staff of 15. So it is incredible when you think about the army of volunteers that are involved with our mission. We can't express enough how much we appreciate that. Redistribution, though, is the next step of that. We want to make sure that we can get these supplies out to our recipients. And so we have shipped to 115 countries since we were founded all around the world. These shipments range in size from what can fit in one suitcase to 40-foot cargo ship containers, or as you can see in this picture, these are hospital beds on a pallet. And so supplies are, as I said, uniquely tailored to what the needs are of our recipients. It's really important to us that we're giving them the respect of fulfilling their requests with exactly what it is that they need to be able to operate hospitals, clinics, medical missions, and other efforts around the world to be able to support those who are in need in those places. Last year we estimate that we impacted over 1 million people around the world through these efforts. Some of the hospitals that we're shipping to are providing health care in areas that otherwise would not have care available to them, and they're providing health care to an entire region or an entire community. Other efforts that we're helping to supply are medical mission teams that are doing pop-up clinics, and maybe they're only there for a day, but still have hundreds or maybe thousands of people showing up for care, because without that medical mission team, there is no medical professional available to be able to help them. These are just some of the photos that we have from some of our shipments. You can see, everything from wheelchairs to, walkers, crutches, canes. One of our incredible board members is here today, Brian Smith, and he's featured in one of these photos standing in front of, a wall of supplies that we ship to Honduras, which he works at he goes to and helps to distribute supplies regularly. But these supplies are being used to, meet the needs of both individuals in these countries with things like a wheelchair, to equipping the medical professionals that otherwise would not have access to these supplies. Again, just another picture of one of our recipients with tons and tons of boxes behind her of supplies that we prepared and shipped out. This picture I'll highlight. These are 2 surgeons that are from university hospitals who went to Ukraine last year to conduct reconstructive trauma surgery due to the current conflict of people that were impacted, and also to train up medical professionals in those locations to be able to do those surgeries later. The vehicle that you see behind them is entirely packed with medical supplies, and this was shipped out, and then the team also took tons of suitcases with them to be able to conduct those surgeries. In the last 3 years, we've shipped over $8 million worth of medical aid to Ukraine. And last year, we shipped 20 40-foot containers of supplies all over the world. I'll also highlight that we do have an International Medical Brigades program, so we partner with groups that take these supplies who are providing the care and working with organizations on the ground to be able to distribute or to furnish these hospitals and clinics. But we do, about once a year, have international medical brigades as well. Due to various factors such as Zika and COVID, over the last couple of years, we haven't had them every single year, but we're excited to be launching them in full force. And this summer, we'll have 2 teams, one going to the Dominican Republic and one going to Honduras. And these trips are open to both community volunteers and medical professionals. So if you're interested in taking supplies and going and conducting pop-up clinics, we would love to have you part of our team, and we'd love to talk with you. There's nothing like being able to see firsthand the impact of these supplies and also being able to support the communities where we're going. So this is more information if you would like to come. June and July, this upcoming summer. I also just just want to share as well, because it is an important aspect of the work that we do. I know today is focused on our international work, but we do have a significant local impact as well. With our supply distribution, about 6 years ago, we launched our local domestic giving program. We were receiving countless calls from our local community because people were in need of supplies. Crutches, walkers, canes, wheelchairs were the majority of the things we were hearing at first. And so we launched a local giving program to be able to partner with local nonprofits, social service agencies, social workers, to be able to fulfill those needs. What's happened in the last 6 years is we now have partnered with over 300 different nonprofits and social agencies, 150 of those here in Cleveland, some are out of state, and we're able to meet those needs of whether or not it's a social worker working with an individual patient who unfortunately their health insurance won't cover the full cost of an electric wheelchair and otherwise they can't afford it. Or maybe they need a shower chair and it's not covered by their insurance at all. Or maybe there's someone who needs to have adult diapers for the rest of their life and those can be expensive and otherwise they're not able to afford them. We also work with homeless shelters and other agencies that are working out in the community to distribute hygiene supplies or other basic supplies that unfortunately, if you're dealing with economic hardship and you're making hard decisions between paying rent and other utilities and buying soap or deodorant or things like that, they're difficult to be able to make those justifications for those costs. And so we're helping those nonprofits to be able to distribute those supplies to the people that they serve. And we estimate that last year we impacted over 50,000 people in Ohio through that distribution effort. We also, through our merger, if you've heard of MedWorks in the past, again, we are all one organization. MedWorks was founded to be able to operate free clinics here in the Cleveland area to those in need. And so as a merged organization, this is all under one roof. And we operate free local health clinics, 100% free, no questions asked. And so someone could come to one of our clinics and receive free vision care, free dental care, free general health, and you don't have to provide a name. You can make up a name. If you're undocumented and that's something that you're worried about going to a local healthcare facility, you can come to our clinics and know that there's not going to be any kind of concern there. We never ask for insurance, so you don't have to worry about whether or not you'll receive a bill after the services. And all of these clinics are entirely volunteer-driven, which is truly amazing to see the medical community in our local community come out to be able to provide this free care. We've had almost 30,000 patients come out to these clinics over the last 15 years. And through that, we've had over 57,000 services offered. I was actually just at the Juvenile Detention Center with a team on Saturday providing free dental care to the youth that are at that facility. Due to the nature of the detention center being a short-term facility when it was constructed, there's not the method or the means for these youth to be able to receive dental care while they're there unless it's in an emergent situation. Unfortunately, due to long court wait times and things like that, youth are there for extended periods of time and have been there for even as long as 4 years. And so not being able to receive dental care unless it's an emergency can certainly be detrimental to someone's oral health. And so on Saturday, we were able to provide 51 youth with cleanings, extractions, and fillings, and we were able to screen all of the youth at the facility to determine if there were any pressing needs. So this is just one example of the clinics that we have. We also have a major vision clinic each fall at the Cole Eye Institute where we're able to provide individuals with free prescription glasses if they're found to need them. So this is a patient that was having her glasses fitted. Again, volunteerism is huge for these efforts with our local clinics. And we had 55,000 volunteer hours donated at our clinics in 2024. The flagship clinic that you may have heard of, or heard of the most, is one that we do each November. It's a 2-day dental and medical clinic that takes place at the Huntington Convention Center. We have over 1,000 people who come out to that clinic to be able to receive care. This past year, we were able to estimate that on average, each patient received $1,400 worth of medical services and dental services at this clinic. So we had everything from cleanings, extractions, fillings, to people were getting mammograms, women's health checks, HIV screenings, podiatry screenings, so a variety of different services. And again, all of this is without any insurance, all conducted by incredible volunteer medical professionals and lay volunteers who are helping to facilitate and make all this possible. So as was shared earlier, it's truly people helping people. Another program to highlight too is our navigation program. We recognize that we are not the end primary care facility for any of these patients that come through, so it's really important that we're able to link them up with long-term, primary care homes. And so we have a navigation team that's helping to connect individuals or to support them with questions on their health insurance, safety net programs, make follow-up appointments, or to be able to find a primary care provider. One of our navigators, I was speaking with her, and she's been doing the follow-up after our November clinic, and some of the individuals did have insurance, but it's a matter of not knowing how to find a provider that's within their network, or how to use their Medicaid, and so being able to help individuals to find where those resources can be identified, and they can then find and follow up for the care that they need. Through that work, last year, over 22,000 people were connected with through our navigation programs, whether or not that's out in the community, at community events, or through follow-up services after the clinics. So really, this just highlights all of the many different programs that we offer at MedWish MedWorks to be able to support the health and wellness of those that we serve. As you've heard, there's a variety of different things that we do. At the end of the day, all the communities and individuals that we serve have different barriers to accessing the resources that they need for their health and wellness. Whether or not that's helping someone to figure out how to apply for Medicaid, or it's helping to supply a hospital in Honduras with the medical supplies needed so that when a patient shows up, they can actually get the care, and the physicians that are there have the resources needed to provide the care that's necessary. So we are really excited with our merged organization to be able to offer so much and take such a holistic approach to the work that we do. But again, I just really want to emphasize how important our community is, because as you heard throughout all of this, none of this is possible without the community supporting us through donations of supplies, donations of time, donations of resources, financial and otherwise. So just really want to thank everybody here for hearing about the work that we do, and I hope you will help us to spread the word. I also just want to highlight that in case you have questions, we would love to connect with you to hear, how we can best engage you with the work that we do. We have a number of staff that are here today, so I'm going to embarrass them and make them raise their hands. But we have Jacob DeZerwa, who's our International Programs Coordinator, who can share about any of our outbound shipments that we have prepared, and Rachel Fox, who's our Volunteer Program Coordinator, who coordinates all of the amazing volunteers that come through our doors, and I know worked with many of you within the last couple of weeks. And Brian Smith, who's one of our board members, who served on both the MedWish and MedWorks board before our merger, and has very jokingly told me that this eliminated some extra meetings from his schedule now that we are all together, which is great. But again, just really want to thank the Rotary Club of Cleveland for this incredible honor, for giving us the opportunity to be here today, and for being involved with the work that we do in so many different ways.
This is always one of the toughest things for me, is following somebody who was such an eloquent speaker. That was really just a great presentation, so thanks again. A couple of things. First off, I would say, Britta, that years ago, my wife and I had the pleasure of attending events at Onsen Farm. So in addition to all the good work you do, you guys throw one heck of an event. Those were fantastic. And the other thing on a more serious note is the level of care, the compassion, and love with which your organization serves communities of need is humbling. So, great job. So, Britta, thank you for accepting our award on behalf of MedWish MedWorks, and for sharing your message with us today. On behalf of our members, Cleveland, Ohio, and all international citizens, we are grateful for your leadership in helping MedWish share in our joint mission, preventing and treating disease, improving access to health care, and strengthening healthcare systems in our community around the world. As a token of our appreciation, I would like to give you this very special Rotary Club of Cleveland pin. Sometimes we say covenant, but we'll say today we'll say special. And then also, we'd like to give you a signed, limited edition, word-inspired design print, the Rotary Club of Cleveland, which was created by artist and fellow Rotarian Gloria Ritter, and it incorporates words describing the club and our initiatives. supporting this year's theme, The Magic of Rotary, as we move forward to living in peace, together as one, and sharing the world. Please carry with you the Rotary four-way test in the things that we say and that we do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Please make today a terrific day. This meeting is adjourned.